Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about why you must check medical insurance billing policies before the new year. Before January comes, and it's coming quickly, it is highly recommended that you review all of your payers' new billing policies before January. The new year not only brings deductible season with it, but it also means that the payers have updated rules, which means that there's new benefit structures, deductibles obviously reset, there's coding changes, and fee schedule adjustments. Why do insurance policies change every year? That's a very good question, and it's usually an annual policy update from payers. Some will change in the middle of the year too, like in the middle of summer. But the changes can include prior authorization requirements, bundling edits, that's a big one, medical necessity criteria, documentation requirements, and reimbursement updates. It's not just a single one policy. I mean, this can be multi-factor, and it can be very, very overwhelming if you just jump into this and learn it as you get denials instead of being proactive before January hits. So we know deductibles reset in January for about 85% of our patients, but out-of-pocket limits reset as well, which is something to be mindful of. And then the tiered plans may have changed the different coverage levels or in the networks of these payers. So that is another thing to be mindful of, because that can definitely influence how things are paid or not paid when you bill out your services. We know that CMS has an annual rule change, so you should have already started reviewing all of that. We know that ICD-10 codes update, so every October, but they're often tied to January usage changes, right? So we get the notice in October, but a lot of times it doesn't go into effect, or they don't start enforcing it till January. I've seen both. And then CPT codes get updated, and payers have specific rules based on the new code sets. So that's always fun. So CMS has new code sets, or they take away, and then the payers run with that and change some of their policies. So, it's a fun game of trying to figure everything out. So what policies should you make sure that you're checking before January? And don't wait till the week before either. You should start this now if you haven't already. So you have to change eligibility and coverage policies. You need to check the changes to covered services for the payers that you bill and specific to your specialty. You need to look at network participation changes and to see if your provider is still in network. Maybe they've added new plans that are not included in your contract, or they took away plans that were on your contract that are no longer existing. Because if that's happening, you need to get the plans you're no longer listed under into your contract if you can. You need to see if specialists require a referral, because that's always changing. And there could be changes to copays, coinsurances, deductible amounts for common visit types, right? We know preventive exams are never going to have a patient cost share. However, all of the other things are up for fair game for changes. Then the prior authorization rules, oh, so fun. So there could be new PA requirements for imaging, injectables, medications, procedures. It's just hard to tell. So you need to make sure that you know the payers that you deal with, that the patients have at your practice, things that you order, things that you perform are not going to require a prior authorization. Sometimes there could be removal of PA requirements. That happens sometimes. So maybe something you're used to having to get an authorization on will no longer require it. So if it doesn't, then that is something to let your team know so they don't keep working on those unnecessarily. There could be updated authorization submission portals. Some plans are switching to vendors instead of doing it through their own portals. They're hiring third parties, so you need to know that. And the turnaround times and documentation changes. I know that they're trying to make a push for authorizations to be done and approved quicker, but I don't know if that's gone into effect yet. But also the documentation requirements for obtaining authorizations can definitely change, and you want to check that. For billing and coding updates, we've kind of talked about it, but there are new CPT codes added from 2025 to 2026. There can be deleted or replaced CPT codes. Then you have your payer-specific modifier requirements that you need to know about and follow. And then there's going to be those bundled, non-covered service changes that all the payers like to throw little caveats to their plans. So you have to stay on top of that. The payer portals and operational changes can also occur. So there could be new submission links that you need to use. The clearinghouse could have updates and new payer IDs that they're linking with because the insurances are changing, or they're adding new links to insurances. So you need to follow up on that. There could be changes to claim submission formats, like maybe they require certain things in the claim notes or something like that that you need to make sure that you're entering. And then there could also be new EFT and ERA enrollment rules, and you might have to re-enroll for one of those or both if there's enough changes that they say, we're canceling everything that's existing and we're starting over, and you have to resubmit. I've seen that happen too. And then of course we have the fee schedule and reimbursement changes. So we have the updated Medicare fee schedule that always goes into effect the first of the year. And depending on what your contracts are with your payers that are not Medicare, they might be based off of a certain year's Medicare fee schedule, but they also could have language in there that they're based off the current year's Medicare fee schedule. And if that's the case, you need to be aware of that, because Medicare's fee schedule has been going down a little bit every year, which means your reimbursements would decline a little bit, and you need to know about that. And then you have some commercial plans that are aligning with adjustments that are going on out there. And then, of course, we have those payer-specific reductions on the high-volume codes, like Cigna automatically downcoding level 4s and 5s to level 3s as of October 1st. We know Aetna's been participating in that, and we're kind of anticipating more payers to jump on board of reducing automatically any of those high-volume level codes being billed out, which, yes, that is ridiculous. We can do a whole nother video on that, but it's something to be mindful of. Of course, all of these changes can negatively affect revenue cycle if you're not aware of them and you're not anticipating and putting proper protocols and workflows in place to adapt to these changes. So January is already a huge month for denials because of insurance changes that patients have, like their coverage changes, and front offices not being very good at doing their due diligence of updating the patient's insurance information, or the patients aren't good at communicating to the staff that their insurance changed. So we already have a high level of denials related to that. And then you add on all of the additional changes that go into place. And on top of deductible season already being a struggle, we have these increased denials for things that can be avoided ahead of time. Because wrong codes are being billed out, you have outdated benefits being used, like I said, missing prior authorizations for things that didn't before require an authorization, things like that. So it's really important that you're taking the steps now to try to avoid that moving forward at the first of the year. You're also possibly going to have delayed payments. So you're going to be waiting weeks or months for payments if you have to make corrections to things. So if you used an outdated CPT code and you had to correct it, or ICD or something like that, and you have to send corrected claims, that is going to delay the processing and the possible payments into your office. If it's deductible season and it goes to patient cost share, that's delaying you the ability to send out patient statements so that they will pay their bill. It's not good either way. And then it's going to also require additional staff time to work the appeals, to work those dirty claims, to make them clean and resubmit. And that is not helpful for anybody either, and it's not efficient. You can collect inaccurate upfront amounts from patients if you do kind of like a deposit for high deductible plans. If you're not looking at the right data and you don't know the right updates for their policies and their coverage, you could be collecting the incorrect amount and end up owing them money back, which is not good. So you would need to refund them. I don't recommend that. And then patients could have a poor experience because they're receiving surprise bills when you're not able to communicate to them the non-covered services they receive and things like that. You also have the compliance risk with billing new codes incorrectly. You could, if it's a high volume, you could possibly trigger an audit at an insurance company as well. You could be charging patients contrary to the new payer rules if you're not aware of them. And you could fail audits because of outdated procedures, and you don't want to do that either. So Q1, Q2 can already be stressful because of the starting over of deductible season, and these changes just add to it. But if you can do anything you can to be proactive, I encourage you to start now. So some places that you can find the updated policies, payer websites. That's the number one place to go. You can look at the medical policies section. You can look at the billing and coding guidelines on the website. You can look at their prior authorization lists. And then you can also try to find an FAQ section for their new year updates. So that is somewhere that I recommend you starting first. You can also go to provider manuals. Most plans release a 2025 provider manual update in December, which will mention things about the new year of 2026. You can also check with your clearinghouses, Availity, Change Healthcare, Office Ally. They push out payer-specific changes as well, and they can help inform you of things that you need to know for your practice. Newsletters and bulletins, I've always talked about that in my videos. Signing up for the CMS MLN Connects newsletter. Commercial payer bulletins, I get Aetna's, I get Blue Cross Blue Shield, Cigna has one, United Healthcare. Sign up for those because that's where they will mention their upcoming changes, but you have to read them as well. Don't just subscribe and let them sit in your inbox of email. You have to read those. And then your EMR or RCM software may push alerts related to payer updates, but I wouldn't rely on that. That's a little bit harder for people to stay on top of. So make sure that you create a payer policy checklist, make a list of all of your payers that you bill out, go to each of their websites, notate any changes that you need to be made aware of. Make sure you bring the right staff into this. If you have a lot of payers that you bill, maybe separate responsibility by payer to separate staff members. So maybe each staff member gets 5 that they have to look up and notate and communicate to everyone about. You don't have to just bring it all on yourself. You can divide and conquer, but you need to take good notes and be aware of what affects your practice specifically. Save PDFs, save things for a reference at a future date if you need to. Create a shared binder or digital folder for everyone to have access to. And maybe keep some kind of chart to compare like last year to this year to the forwarding following year, like 24, 25, and 26, just to help maybe try to stay up on trends. You want to make sure that you do a meeting with your staff who this affects and make sure that they are understanding all the changes so that they're not wasting their time and that you're able to capture everything that's billable that you can. Update internal workflows as needed based off the policies as well. And if you have any payer representatives at the insurance companies, use them as a resource. I know that's less and less available now from these insurance companies, but if you're lucky enough to have an assigned representative to your account from an insurance company, definitely reach out to them and ask them things that you need to know for the upcoming year so that you can plan. The biggest thing is that you have to plan now. You need to start looking this up. You need to make changes to your workflows, educate your staff, educate your patients now so that you don't get hit with denials, recuperations, refunds, things like that in 2026 because of the lack of knowledge and preparation now. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with your colleagues whom you feel would benefit from this information. Be well, take care of yourself, and we'll see you next time. Bye-bye.